And we're live. Welcome everyone to our special presentation on the GreenSurance Advantage. I'm your host, Virginia Parsons, and I'm known as the Hangout Mentor and the founder of Hangout Marketing University. And I can help you, the healthcare provider, establish yourself as a recognized authority and grow your patient base and following using Hangouts on Air, which is what we're using today for this presentation. So you can get more information on my services if you'd like them at hangoutmarketingu.com. Now, you are in for a real treat today. You will be getting a detailed overview of the GreenSurance Advantage from Carrie Gray, its CEO and founder. So if you are an alternative healthcare provider, you're in the right place at the right time. Today, GreenSurance is an alternative therapies co-op initiative for health coverage, and Carrie is going to explain the GreenSurance Advantage today and be able to answer all of your questions. Now, we're also excited to be able to welcome Clara Weisner to the show. She is the owner and founder of Revolutionary Lifestyle, and she's a functional nutritionist and a transformative health coach. She is the newest member of the advisory team of GreenSurance and leads the Give Back program for GreenSurance, which is now in development. So we're very excited to welcome Clara to the show. So Clara, why don't you start by coming on in and saying hi to everybody?
Hi everybody, I'm Clara Wisner and the owner and founder of Revolutionary Lifestyle. I envision a world where people view self-care as foundational to all their other successes in life. And so all of my professional, personal work is focused around that goal. And I focus on preventative, whole person, unique, bio-individual care based in nutrition and lifestyle. And I think it's the key to vibrant health. But it's also not what conventional medicine focuses on. And I want all people to have the option to focus on preventative whole body care. And so that's why I actually was seeking out something like GreenSurance, searching around the internet, and happened upon GreenSurance and was really excited because I had thought that this was a huge missing link in this alternative healthcare system. And so I'm really happy to be part of it, really happy to support it. And I also am starting the Giving Back Fund, which is a way for practitioners like myself to contribute to GreenSurance through just giving a little bit of a kickback from our proceeds to help maybe people that are a little bit they're a little bit less fortunate, but they still would like to try alternative medicine. That's what the Giving Back Fund does through GreenSurance and through what I'm starting. So that's a little bit about me and how I came to find GreenSurance and my role in it. And so I'm really happy to be here. Thank you.
Thank you, Clara. And I think it's just really wonderful that you had that inspiration to say, how can we incorporate the Give Back program for people less fortunate? I bless you for having that in your mind and bringing that to Carrie. So let's bring Carrie on. Carrie Gray, the CEO and founder of GreenSurance, who is the innovator of this entire concept of providing for people an alternative way to get health coverage that they just couldn't get from alternative practitioners. And she's expanded it in a way that's going to help everybody. The traditional healthcare provider, the alternative healthcare provider, and of course, the patient. So Carrie, come on in, say hi to everyone, and when you're ready, you can start the presentation. Just let me know. You're muted, so let's try it again. Unmute.
There we go.
That's it.
Good. Aloha and welcome. Thank you for joining us. We are streaming from different locations, and I'm here in Hawaii. So thank you for joining us. And we promise that today's information is going to inspire you to make a decision based on the education that this brief presentation is going to give. Now, we know time is valuable, and we recognize that your time is important. So we promise that this information is going to be well worth the time that you invest. So if you'd like, we'll go ahead and get started with the presentation and let everyone kind of digest the information. We're going to stop a couple of times for breaks. We'll be able to have a kind of interaction, and we want you to know that our website is actually very pivotal to this conversation. So mygreensurance.org is where you're going to be able to find more information about all the things that we're discussing here today. So let me go ahead. Can everyone see the screen share, the presentation?
We'll let you know as soon as it comes up.
Okay. Is it there?
No?
Let's try. Okay, hold on. Let's try this again. There we go. How's that? Can you see the welcome?
Yes. There's a delay.
Yay.
Just be aware, you know, because we are doing broadcasting this around the country and the world. So
yes,
we're ready to go. So go ahead, Carrie.
Awesome. Okay, great. So we want everyone to feel welcome today because the information here that we're sharing is really about people who are ready for change. And the practitioners who serve those people, whether they be natural or conventional, who are also ready for a change. Now, what are we talking about? Change, time for change for what? Well, it's this issue that we all, as people of the United States, have all been forced to accept, which is this Obamacare legislation. And for many people, it's become quite a problem. In fact, we see demonstrated here in this illustration that it's really a large pill to swallow. And that's what we want to talk about today, because when that law came into effect, people were left with a lot of negative emotions, being lost or confused, disoriented and bewildered, and that's no way to make a decision based on something as important as your health care. And so what we want to do is educate you, to inform you, and to empower you to make the decision because you now understand what you're facing. And so what we have to start our discussion with is this. You see, today we have what we call the wealth care system. And as the picture illustrates, it's a very disproportionate image here of how many people are supporting a very large glutton of resources. And what we want to talk about is this, and that is the health insurance industry and how their profits are determined by how they don't pay claims. Really, that's honestly the truth. They have premiums and they're not paying claims, and that's where they're able to keep billions in profits. And so before Obamacare, it was very clear that this was a highly profitable industry. But since Obamacare, we know that the insurance industry has raised rates. So what have just a couple of websites here that we found, what do they have to say? Well, it's clear that Obamacare is bad for people and that profits are soaring for the insured while the insurers are benefiting. So when we look at publicintegrity.org, it says that United Healthcare Group, which is the largest insurer, it reported that it made $10.3 billion in profits just in 2014. And it goes on to explain that the people who have benefited most are the top executives and the shareholders of these insurance companies. And when we look further, it says among 5 of the largest insurers, their stocks went up an average of 107% over the last 2 years. And so when we take a look further, what we see is that this ACA compliant plans that have to require certain benefits that the insurance companies raise their pricing for to include, it meant that while they claimed liability, they really didn't have added liability. And to illustrate that, Obamacare has 10 different criteria that an insurance policy has to meet. So while that sounds great, if you're a 40-year-old man who has a maternity policy, do you see the problem? So what people are doing is paying extra, and they're not getting extra. And in fact, it goes further because the reimbursements to the practitioner is lower than Medicare. Now, that's a big problem. And if, for instance, if we just take a look at what private pay insurance maybe pays $1 for a service, Medicare pays 80 cents, but these ACA exchange plans are now paying 60 cents on the dollar. And what does that mean for a practitioner? Well, a think tank study of the American Action Forum finds that the exchange plans truly are cutting provider reimbursements by up to 40%. And doctors, now this is the pressure that the doctors are being put under. They're expected to take on more patients to make up for lost revenue. And as if they already don't have a huge patient base that they're carrying. And really what the issue is, now we get to the practitioner-patient dilemma here, and the practitioners are being pushed by the insurance company to take on more patients, and the patients are feeling jilted because their practitioner doesn't spend time with them. And so this now is the reason. We hope you understand. So according to a 2014 survey, how are physicians responding to this added pressure? Well, according to the estimates here, some nearly 215,000 physicians will not participate. So what that means basically is you can buy a policy, you can go to a network practitioner, and they won't accept you. That's what's happening. So conversations with people all the time who indicate that they bought a Blue Cross Blue Shield policy, for example. It was a recent conversation I had with a lady, and she said, but all the practitioners in my network, none of them will accept my insurance. This is the reason why. So the study points to 2 reasons. And again, this just helps us to understand both sides of this issue. 75% of the ACA patients that had seen a doctor chose a plan, maybe the bronze plan or the silver plan, with high deductibles. And what that means is now the insurance industry doesn't have to participate, the policy doesn't have to participate, and the patient and the provider get stuck with the bill, as it noted. So Health and Human Services requires that insurers cover an additional 90 days if anybody ever defaults or doesn't pay their premiums. And that's to prevent lapse of coverage. Now, here's how they're doing it, though. So while the insurance company covers the first 30 days, they're pushing the next 60 on the doctor. Very interesting. And then it goes on to note, this website, cnsnews.com, that this is the #1 reason why providers are opting not to participate. Can you blame them? So currently, about 1 million people have failed to pay their premiums and have had their plans canceled. So the dilemma continues. And that's why today it seems that we're all being forced to play a game that nobody wants to play. And that's the government's healthcare game of Medicopoly. And while this is not a game, this is life, and it's the cataclysmic responses to this barrage of problems is from practitioners to individuals. Everybody is feeling the same: frustrated, confused, angry, just really in a dilemma about what to do. And so, as Albert Einstein observed so brilliantly many decades ago, he said, we cannot solve our problems with the same thinking we used when we created them. And that's why we're not here to talk about problems. We're here to talk about change. We're here to talk about what changes are just ahead. And so, in order for change to be effective, you see, we have to have a solution that's free of financial gain, that has no political agenda, and that is about putting people first. Yes, it's a fresh perspective, and it's just ahead, as you'll now find out. So when we were discussing the patient-provider relationship, or what we're talking about here is a fresh solution and an innovative answer to what's really going on in the healthcare system. You see, according to the Center for Disease Control, chronic diseases are 7 of the 10 deaths each year in the United States. Think about that. 7 of 10 deaths are from chronic disease, and it goes on to note that 75% of healthcare is in treating chronic disease, but it adds this, many of which are preventable. That is the irony of this issue. So when we really distill down the real cost of healthcare, what we find is that many people may be taking risk and just paying a penalty and saying, I'm just going to go with alternative treatments. Or maybe they're in compliance and they buy the healthcare coverage, they get large deductibles, and they're going ahead and self-funding their alternative treatments. And the reason why is because people see the value of how much better they feel with alternative treatments. And so, excuse me, the result is 158 million people right now, according to the Census Bureau, are estimating to be self-funding. And their spending is about 100 billion cumulatively on an annual basis. Now, that was in 2014. In 2007, just to show the trend here, 2007, it was 33 billion was the estimated cumulative spending. So there's been nearly a triple increase in this arena of natural medicine. Why? Because it delivers results. So really what we want to talk about here is there's a decades past due need for a comprehensive health plan. And really when we talk about an alternative to Obamacare, we would have to include things like natural medicine being included, natural medicine being reimbursed for the first time, natural treatments for a diagnosed condition by an MD, a DO, an ND, a chiropractor, they would be reimbursed. That if they were a part of a diagnosed condition for these natural treatments, they would be less invasive, they would cost less than conventional, and they would prevent more costly conventional treatments. And I'm sure everyone agrees that that really makes a lot more sense than the current model. And so when we take a look here at what the current model is, so under natural medicine, we see that there are 12 chiropractic, massage, and acupuncture visits per year that anyone is allowed to have that's under an Obamacare plan. However, when we look at the alternative to Obamacare, this is what we're talking about. These are the kinds of diverse treatments and life-saving, health-restoring, preventative diseases that alternative treatments are able to address. And yes, these are not patented treatments that have market control, but these are the kinds of treatments and therapies that really restore people to optimum health. And so what we have to accept, though, is that there will never not be a need for conventional medicine. Yes, people will always have medical emergencies. They'll always have a need for surgery, for emergency rooms, for physician services, laboratories, x-rays, you name it. There's always a need. And so that's why the Obamacare alternative would have to include conventional medicine as a comprehensive health plan. Now, what I want to share with you is my story. You see, this picture illustrates, and it's called The Light in the Darkness. And what I want to do is tell you now a little bit about me and who I am. And you can see the screen is going to pop up with some of the things that I've been able to do in my life. And what I want to hone in on is this, is that here I am in my 20s, and this is when I was diagnosed with terminal liver cancer. I was given no medical options when I was diagnosed. I was told I was beyond the scope of chemo and radiation. And that really was a day that going in for a physical and coming away with this kind of diagnosis, I'm sure everyone can appreciate that no one sees themselves facing this kind of news. It's called an unthinkable for a reason. And what happened is that though I was left depressed, debilitated, dying, and just completely without hope, I had a problem bigger than losing my life. You see, I had these 3 beautiful children, And as much as I love my children, the idea of grieving for losing them was bad enough, but my grieving was about what they would go through, because though they were small and didn't understand the cataclysmic results that would happen from losing their mother early in life, I did. I understood that. And that's what I was just devastated by, trying to figure out a way through this. And so praying for wisdom is really what gave me the ability to have a lifetime of epiphanies. And the first one was the fact that I needed to fight. I needed to not give up, and I needed to make sure that even if I did die, that my children knew that their mom exhausted all options to make sure she was there for them in their life. And so, as we call it today, fight like a girl. You see, what this did, this choice of fighting, it gave me a new chapter in my life. And that chapter pushed me here. You see, while conventional gave me no hope, I, without any kind of awareness of what natural medicine does or how effective it is, I just saw it as just an option that I had to explore. And when I went to my natural practitioner, she, without being notified prior to the medical diagnosis, she also found the terminal cancer. She warned me that I had not much time left, and but she was the first voice of hope. She was the first one who gave me the ability to see that in the darkness that I was in, that there was a light. And that light would revolve around several things. She said, you have to embrace complete life change. And she said, you have health insurance. And I said, yes. And she goes, well, then you have to accept that it's not going to help you any. This is not going to pay for anything I'm going to tell you. And if you're willing to accept that and know that this is going to be expensive, I can help you. But it's going to take those three things on your part. And I said, okay, I guess that's what I'm going to do. So that's really what happened. So sweeping life changes, and thousands of dollars were spent in just this very aggressive protocol of trying to restore my health. And what happened is, when I made this choice to try to regain my health, of course, as she warned me, there was no health insurance, because I verified that by submitting receipts to my insurance provider, and the letter came back saying it was a denial of benefits because it was out of coverage and it was unproven. Now, what was called unproven within a year actually did this. Yes, I was diagnosed with follow-up tests as a cancer-free miracle. And what my practitioner, who didn't really want to accept the fact that I had gone natural, what she did was she made this statement to me, though. She said, the liver doesn't do this by itself. And while I don't want to know what you've been doing, I'm here to tell you that it worked. And so what I had to really recognize is that as perplexed as I was by her statement, that she could see both of the test results, the before and the after, I really felt that she felt that this was an infringement on her ability to practice medicine. And so, you know, this is in 1988. People were very narrow-minded and very closed off, even in the medical community, and not like today. Today we have a very much an embracing of functional, integrative, and complementary medicine, and we want to thank you, providers, for doing that. So, whoops, let's close that. And so what we do is take a look at this. See, when I became cancer-free, what I recognized is that I needed to start becoming committed to living healthy. And so that's what I did. I learned about the body, and I learned how to keep myself healthy, and I learned how to be health responsible. And while I could do that for my health, my financial plan, though, I didn't have an answer for. You see, no matter how much I searched for what I thought was the obvious here, which was a health insurance plan that would make sure I was never put in that financial position twice to self-fund, well, no matter how much I searched, no matter what company I spoke to, the conversation always ended the same. So for 2 decades, I searched for alternative medicine health insurance. And what was interesting is that in 2013, that conversation came to an end. Yes, in January 2013, I was offered an opportunity to become an insurance professional, and well, it was a change in life, so I accepted it. And so what happened, though, is when I became an insurance professional and I understood the mechanics of insurance is when I made a profound discovery. You see, I was able to finally understand why my health insurance denied me decades earlier, because for me, it seemed that I wouldn't pay premiums from the grave, so why wouldn't the insurance company keep me alive? I didn't understand that. Well, that's logic and reason, and you have to understand that insurance policies aren't based on insurance, on logic and reason. They're written in such a way that they become the law, and the adjusters are the enforcers of the law. So much like how a judge is bound by the law, so it's the same with an insurance adjuster. They're bound by the laws of that policy. And so understanding how that works then gave me the ability to discover how to solve the problem. So in July of 2013, I wrote a patent for this product here, holistic health insurance. And we launched GreenSurance originally as a test market for holistic health insurance, for a standalone separate product that people could buy in addition to a conventional policy. And while we began to launch this and had phenomenal response from people, they were so excited to realize that, yay, something here was going to provide them the ability to not self-fund natural treatments any longer. It was complicated because while we recognize that choice is powerful medicine and that there was this decades past due need, it was this thing that happened in October. And we all remember that when that happened is when the government was shut down over this gridlock over affordable health care. And really, it was called affordable health care, and it was legislated that you will buy health insurance. But really what ended up happening was instead of it being affordable, people were ending up, their policies were being canceled, they were having to assume huge deductibles, and on top of that, they were making mortgage payments to an insurance company. So yes, while Affordable Care Act was a misnomer for the very young, oh yes, it was very economical for the very young. And if you took a bronze policy where you took a large deductible, oh yeah, it was great. It was great. But did it really solve the problems? Well, clearly it did not. And so we're going to stop our presentation here, and now we're going to discuss any questions that may be as a result of the conversation up to this point. Virginia?
Yes, so I just wanted
Okay.
to make sure.
That's fine.
Yeah, so I do not, and as I say, I think that there's lots of questions that could come up, but I think people are really engaged with what you're presenting, and there's so much good information in there.
Well,
I think we're doing okay.
It's a lot to digest, yes?
Yes, it is, but it's so valuable. I mean, I've been taking mad notes here, and you know, one of the quick comments I'm going to make is a note that I made that is sort of the foundation of what I really gather out of what you have done with this innovative solution, and that is that a solution must be free of financial gain, with no political agenda, and that puts people first. So that to me just wraps this up so beautifully, and I think that it's the foundation of everything you're doing. Perhaps we want to bring Clara back on just briefly, since I know she has to step out early, and get any comments or feedback that she might have. Clara? Unmute yourself. There you go.
Hi. Yes. Yeah, I'm always, the biggest thing for me about GreenSurance is the choice factor, and giving people that ability to choose, and that's just so important, and that's one of the biggest problems with our healthcare system now, is that people don't have choice, and there's kind of this one way or the highway kind of mentality with conventional medicine, and so it's huge. And also the fact that this is an insurance plan or a health benefit plan that is good for the provider, which is, you know, where I'm coming from, and the person getting the health care as well. And so that's just an incredible, and it's the way that it should be. And so, yeah.
And one of the points that I wanted to make too, Clara, was from the standpoint of being a practitioner in alternative health, I would think that this adds, by being able to offer this or accept this from patients that can have their alternative health treatments paid for through this program, does that not add a whole nother distinction and differentiator to your practice versus someone who is a healthcare provider who does not offer this service?
Yeah, totally. It's definitely a differentiator, I mean, it allows me to serve more people ultimately, and therefore is a huge differentiator for my practice and for me as a provider.
Great, thank you so much. Now, what I want to say is that I am monitoring the event page right now. So if you have any questions, make sure that you put the comment right down there, right below in the comment section, and I will bring it up to Carrie as we go forward in the presentation. But for now, we have a little bit of quiet going on there. So don't be shy. If you have a question, go ahead and send it our way. And by the way, if you happen to be someone who's registered for this presentation but are catching it in replay mode, know also that we will be monitoring your questions as you put them there. And finally, just know that you've got the best resource in the world by going to mygreensurance.org to get information there as well. So, Carrie, you want to go on with the next part of the presentation?
Absolutely, absolutely. So, okay, can you see the screen? Do you see your questions still on the screen, Virginia?
Yeah, you're good to go.
Okay, great. Just wanted to make sure. All right, I'm not too good on this technology stuff. So what we want to talk about is this change. So we started our presentation about talking about people, providers, and practitioners, and just the general populace that are ready for a change. Well, change for what? Well, here's what we're saying, is that when I recognized all of this dynamics about health insurance and what was really going on in the industry and the way people were being treated, you see, what I came to understand is that as much as people were excited about what GreenSurance was, what I had to understand also was their frustration, because oftentimes they were put into networks that the practitioners either didn't provide the services they needed, or the insurance company wasn't paying reimbursements to the practitioners. There were so many problems, and so what I realized is that GreenSurance really is bigger than an insurance policy. In fact, what I had to think about was that perhaps within the legislation itself, maybe the answer was the problem. And what I mean by that is this. When we look at healthcare reform, we have to look at, there's thousands of pages that this Healthcare Reform Act contains. And so in order to achieve a new result, we had to have a new mindset. And that's really what we have to think about. And so here is where it came from. So the 26 U.S. Code 5000A, it's called the Requirement to Maintain Minimum Essential Coverage. And it calls it a health care sharing ministry. Now, don't get lost in the word ministry. That sounds religious, but actually the code explains what it is. Notice it says here, it is a organization. That's all this means, is a health sharing organization. And that is defined as members who share a common set of ethical beliefs and share medical expenses among the members in accordance with those beliefs, without regard to the state in which they reside or is employed. Now, here is the problem. It says they had to have been in existence at all times since December 31st, 1999, and its members have been shared continuously without interruption since at least then. And they had to have an annual audit performed by an independent certified public accounting firm. So what happened is that while the legislation gave a caveat to select organizations who could meet this very narrow criteria, what happened was that many organizations could not. And so as much as cost sharing may be a term you're unfamiliar with, when we look at the industry, here's what we found. It's been in use it's been in use for over 30 years. And it's been used by over 500,000 people. And collectively, it's paid over $1.3 billion in conventional medicine expenses. Okay, so only for conventional medicine was it used, but it was a very effective platform. And so what I set out to do was to find who remained. Yes, that 1999 caveat really dismantled many of the cost-sharing organizations that were in play at this point in time. And so who remained, though, were select organizations, one of which that we became a partnership with, who began in 1988, and together who had paid out tens of millions of dollars to thousands of providers for conventional medicine. So what I did was I realized that as a group of thoughtful, committed people, we have power that we just don't realize when we're splintered. See, when we come together, we can make change happen. And while we're not going to change the wealth care system and the greed of that system, what we can do, though, is we can make change possible and not participate. And this is where the GreenSurance team, we call it the Green Team, where they've come from. So a lot of different talented people that have brought to the table different kinds of commitments to help us bring something that is bigger than all of us alone could ever do. And what we're doing is we're paying it forward. You see, what we wanted is a new day in healthcare. We wanted to have an alternative for alternative healthcare. And what we wanted to do was integrate that into this cost sharing platform. So a 50,000 member cost sharing platform was this information about GreenSurance was presented to. And the response was a 94% approval vote of that cost sharing organization. And so with a unanimous response, GreenSurance became part of a nonprofit coalition where multiple nonprofits have now become involved in this coalition for a better health care. You see, in order to have different results, we've got to start thinking differently. And as our chart says, see, it's the same old thinking with the same old results. And if we're going to break free of that, then we've got to start looking at how to bring effective change. And that's what GreenSurance is about. We are the health plan freedom. And we believe that once you understand what this freedom offers, that it will be the last health plan that you'll ever need. You see, our goal, our mission in GreenSurance is to take "it's not covered by my health insurance" out of your healthcare conversation. And when you think about that, that's really life-saving. See, GreenSurance is about shattering this invisible barrier that insurance has created between conventional and between conventional and alternative, between allopathic and holistic. It's shattering the barriers so that they no longer exist, because what we are is we are a symbiotic healthcare plan. And that means everyone benefits: practitioners, patients, and the co-op community. We all are benefiting from coming together. And that's why we want to talk about options, because options is what we're really discussing. And this is because we believe at GreenSurance that choice is powerful medicine. That choice, whether it's conventional or natural or a fusion of both, should be what your healthcare provides. And that's why you can go to our website, mygreensurance.org, and you can join us as part of this community. So our focus is people, not profit, and we are a self-funded health plan. And that means we are independent of health insurance. So what does that mean basically is it's likened to a credit union. A credit union is a member-owned organization, and while it provides the same services as a bank, well, we know that the agenda is clearly separate. So cost sharing is separate from health insurance. That's why we have a different vocabulary. So while this may be a scene all too familiar with those who are dealing with health insurance, GreenSurance is here to say that this is a thing of the past. And what we are able to do is provide far more for far less, because what we've done is we've distilled down a health plan. We've gotten rid of the fat, as they say. We've gotten rid of the health insurance component that was squeezing the patients and squeezing the practitioners, and really giving people the ability to see what the real cost of healthcare is. So while we're doing all of that, we're able to do it in this penalty-free environment. So that's right, there is no penalty with the GreenSurance health plan. And what the amazing benefit here is that if you become uninsured, you pay a penalty for every month you're uninsured. But if you join a cost-sharing co-op, what you find is that the entire year, even if you haven't been insured up to now, if you join a cost-sharing co-op, you're exempted by the whole year. So that's a pretty nice benefit there. Now, the question is often asked is really, what is GreenSurance? Is it because I'm in Hawaii? Is it just in Hawaii? And the answer is absolutely not. This is a national health care plan. And what we provide is a $1 million per incident benefit. So it's not coverage, but it's a benefit. So what that means is that the community will back you for $1 million for any health crisis that you face, any kind of health issue, not per person, not per diem, but we're saying per incident. So you could have multiple incidents even in the same year, and you would have $1 million per incident. So what we want to do is this. We want to simplify the health plan opportunity that we're talking about. We want to bring an innovative solution to practitioners, and we do that through an organization that is also part of our co-op here called Global Care. Now, for conventional practitioners, that's probably a name you're familiar with because they are a large third-party payer who does a lot of business. But for the naturopaths, that may be a new name, but it's a name you're going to want to know about. You see, through Global Care, what we're able to do is provide reimbursement to providers for our co-op members in 14 to 30 days. Now, when you look at the medical insurance comparison, 90 to 180 days. That's 90 days for conventional medicine and 180 days for government medicine. So really, we're talking time is money here, and we recognize the value of what practitioners are facing. So what we want to also say is this, is that for the first time ever, can natural treatments by a state licensed practitioner be included in this health plan? You see, when we go back to our original screen about the Obamacare alternative, this is what we're talking about. A health plan that makes sure that natural practitioners are reimbursed if their treatments cost less, if they are less invasive, and they prevent more costly treatments of a conventional nature. That is what the brilliance of this health plan is all about when it comes to conventional medicine. Now, when it comes to when it comes to natural medicine, when it comes to conventional, the reimbursement is an unheard of 150 to 170% of Medicare. So 100% of Medicare plus 50 to 70% more. So conventional practitioners absolutely love what this health plan is about. And that's why it's been in existence for over 30 years, because it's been reimbursing practitioners at a higher rate than what they're used to being paid. So what we're saying here is this, is that through our website, this member community, what we want to do is we want people to be healthy, and we know that they'll be happy when they're healthy. And what we want is our network providers to have access to our free advertising platform. So any practitioner that joins us, while any practitioner can be paid by the co-op, only the practitioners who enroll in our health plan are going to be able to be found through members who site search for a network provider. And there you'll be. So if you love what you're hearing, and we think you do, then what we want to say is this, is that we want you to feel that after you enroll as a practitioner, as a provider, that you can refer your patients to GreenSurance. Because through electronic billing, we can end much of your billing hassles. So when we take a look at from the individual member side of this, so we invite practitioners to join as members of the health plan and on top of being in our network. So irregardless of who you are, what we want you to do is this. We want you to see how GreenSurance compares to a typical insurance policy. And so what we're talking about here is we're looking at this. This is your annual cost, for all of the things as a single member that you would incur. And these are listed here, and they're given on our website as well. So annually, a single person's up to the age of 65 can keep their healthcare costs to around $4,100 annually. Married people, $5,800 annually. And for a family, no matter how many children they have, less than $6,300 annually. Now, when we're looking at conventional health insurance and noticing that people are taking deductibles that are $5,000 and up, well, I think the answer is pretty clear. So if you're on this webinar and you are an individual, we recommend that you send your practitioner to our website. And that's how many practitioners are signing up, because their patients are recommending GreenSurance. So the provider enrollment is just a simple two-step, no-cost process. And the reason why it is we want state licensed practitioners who become our co-op members' primary care physician, MDs, DOs, NDs, chiropractors, we want you to focus on optimum patient care. Because really, isn't that why you got into healthcare to begin with? It wasn't to fight with an insurance company, but it was to provide give your heart to your patients and to really help people combat the health challenges that they face. And so what we want to do is this. We want you to see all of the advantages, the distinct advantages that GreenSurance is able to bring practitioners. And so now how we do that is through our payment system. So only network providers are going to gain access to an added benefit, and that is we pass on our 1.6% merchant processing account rates to all of our co-op practitioners. And what we're developing is a proprietary payment system to expedite even the 14 to 30 day reimbursement. And so our goal for practitioners is to drive down your cost of business, to increase your profits, pardon me, to make you happy, so that this is a workable solution. This is a workable answer for everyone. And so through our unified payment system, you can process all card transactions. You don't need a separate terminal. This will be able to handle all of your card system or card processing, MasterCard, Visa, etc. But it will also be able to now take the GreenSurance payment solution. So our proprietary payment solution is in development right now. It's not yet released, but it will be very soon, and it's going to be very exciting. So that will be what our network providers will be advised of. So what we want to do is invite you to join us. Join as a member, join as a practitioner. The network provider enrollment is free, as well as the enrollment as a network processor. Because what we're providing is exclusive network provider benefits, and those again are found at mygreensurance.com. If you look, we have 6 different categories on your menu, and if you're a practitioner, you look for health practitioners, and if you are a member, you go to the health plan. So what we want to do now is talk about some frequently asked questions. So for instance, practitioners want to know, well, can I still take insurance? And the answer is absolutely. And how do I tell my patients about this? Well, this is where we are innovative, because you see, whether it's a personal consultation, it's an email blast, it's a newsletter, maybe a webinar. We'll be glad to do a webinar with your patients. You can do a handout, just direct people to our website. That's the bottom line, and give them the ability to make an informed decision. You see, whether you're a network provider on this webinar or you're a co-op member, really what we're talking about is choice. And now we want to talk about this. While this is a reality check, maybe you're still undecided. It's okay, we understand. It's a lot to think about, a lot to digest. But what's interesting is the Donald and what he has to say about Obamacare. He said, in part, let me get this straight. We're going to be gifted with a health care plan and forced to purchase. We're going to be fined if we don't, which purportedly covers at least 10 million more people without adding a single new doctor, but provides 16,000 new IRS agents. Okay, so do you see the problem here? And he goes on, I'll stop there. But the point is that not only is this healthcare plan not working, but as you could see earlier, doctors are not participating for valid reasons. So everybody has to pay for this new Obamacare tax. Now, this is an article recently released, as you can see, August 8th, by the Daily Caller News Foundation. And just in part, let's look at what it says. It says Americans who bought policies face a 41% excise tax. And it was buried in this Affordable Health Care Act. It said the tax bill this year costs more than $500 in extra premiums to an individual and to a family by more than $700. And it goes on to say that the sticker shock doesn't stop in 2015. Over the next 4 years, the mandated fees are expected to double, and it will continue to go up each and every year in the future. It was buried deep in the law so that when obviously President Obama left, it would go into effect, and it said that it was envisioned as a way to raise future funds. So Senator John Brasso said it's just another example of how the most painful parts of this are kicking in years later. Now, it noted that the only group exempt are the self-insured, where no insurance company is used. That's what we're talking about. So the Affordable Health Care Act, folks, is not your only option. You do have a choice, and GreenSurance is here to tell you that you do. We invite you to join us now. And what we want to do is, again, visit what it is that the difference here between GreenSurance and Obamacare. And if choice matters to you, and if having more for less matters to you, then be sure to make an informed decision. You see, GreenSurance is health plan freedom. So again, please visit our website, mygreensurance.org.
Great presentation, Carrie. Bring yourself back on so people could see your beautiful face, the brilliant woman behind all of this, because it's totally inspired. And it came from you, many, many years ago. What were you talking about? 28 some years ago, when you were diagnosed with terminal cancer, where you weren't going to live past that year, right?
Right.
Oh my gosh. So, she's now publishing a book, by the way, that you'll have an opportunity to get your hands on. What is that book called, Carrie?
How Cancer Saved My Life, and Now Maybe Yours Too.
I love that. I love that.
Thank you.
Well, you really are providing so much food for thought. And again, I was taking down lots of notes, and some of the highlights for me, I'm trying to think of it through an alternative health practitioner's eyes, which I'm not, but just to take a look at some of the highlights to me is that 15 to 30 day reimbursement of what their charges are is really powerful. And you say that if they were getting reimbursed through traditional insurance, that it might be 90 or more days. Isn't that right?
That's right. Yeah. Well, generally, conventional insurance reimbursement is 60 to 90, where government insurance is about 180. So about 6 months it takes. That's a long time when you have so much going out as a practitioner, and you have so little coming back in. So you can really see why this is not working, and why practitioners are standing up and saying, "I'm not participating. I've had enough." They're tired of what insurance is doing. They're squeezing everybody to make sure that they have this big fat portion for themselves. And what we're here to say is this: is that yes, well, you can continue to be insured. It's entirely up to you. You can continue this, but now at least you need to know what you're up against. You need to understand the taxes, the penalties, and the increases that you're going to be facing, and why you're facing those. And if that is something that just doesn't set well with you, if you're ready to get the government out of your health care and really start taking some ownership, then you can join us, because that's really what we are. We're a self-insured co-op that is member driven. And what our focus is distilling down and making an organic health plan that really just gives people what the real cost of healthcare is. And that's why it's shared amongst the people, instead of having this big fat insurance component added to it to bloat it and to make it so egregious for people that are really overwhelmed by what's going on.
Really, really powerful. And the other thing that you really pointed out, a couple things that I took note of today, and I've heard you talk about this a few times, but those who are providers who are enrolling will basically end up with some free advertising as a result of this, because they're going to be listed, they're going to be shown as people who are participating in this program, so that the patients who are using the co-op program can say, oh, there's somebody who accepts it, and they're the person I'm going to go with. And that's really why I said to Clara, this is actually another differentiator for you as a healthcare provider. Right. And I think it's an important one, because people are always looking for what sets them apart from their competition, basically.
Right. So, at some point we're going to have a sticker for our practitioners that'll have it on their door, and it'll say, we accept GreenSurance or GreenSurance approved, something like that. So that, it really just kind of adds to this whole community effect or community feel that we're all in this together, and we can do this together. but we just got to get organized. And that's really what we're talking about, is how to organize and set ourselves apart from all the problems of what's going on, and recognize that thankfully the law allowed for this. Now, my own speculation is that the reason why the shutdown is because what insurance really wanted was they wanted to make a monopoly out of this. They wanted to enforce the law to such a point that there was no exemptions, but monopolies are illegal. So they had to give some wiggle room. And so that's what they did. They allowed for a few exemptions. And that's why we have to maximize what those exemptions are about. And that's what we're here to do. We're here to say is, folks, you can do it. You don't have to be emasculated into the system. You can actually find a way out, and you can do it in a way that benefits you, in a way that you never realized possible.
Well, and that seems to me that that's another huge advantage when you're looking at it from a consumer point of view. If the consumers aren't aware of, which I certainly wasn't aware of, this excise tax that's going to add an additional $500 to $700 onto premiums and go up again, that a program such as this is exempt from it. So, people don't know these things. As you say, if it was buried in the terms of the agreement, I think that as people discover, first of all, they have to become aware that there's an alternative. And as you said, they can maintain the insurance that they have and then add this co-op to it, or they can be fully covered by the co-op itself.
Right.
And one question I had about that is, what kind of deductibles, if any, are part of the co-op?
Great question. Well, it was on those screens earlier that we shared, but we went through it so quick. But basically, there's three. Let me get right fingers up here. There's 3 different deductibles. So if you're a single person, if you're a married, or if you're a family. Okay, so single person is $500. Insurance calls it deductible. We call it the unshared amount. So the first $500 for when you become a member, that's when your calendar year starts. It's not about January. It starts the date of your enrollment. So $500 is what you pay. Married pays the first $1,000, and a family pays the first $1,500. After that, then the co-op health plan is yours to use and to benefit by.
And you also said that there are no denials as long as there's no pre-existing, correct?
Well, let me clarify that. That's a great question. So what that means is that once we have, see, when you go to your primary care physician, you don't need a pre-approval to go see them. But when they diagnose a health issue, and then they diagnose a payment, or excuse me, I forgot to plug in my computer, sorry. When they diagnose a treatment plan, what happens is that those are pre-approved. So once they're pre-approved, those are no denials. There's no games or gimmicks that the insurance company plays with practitioners. So that's where that comes from. And the other part of your question, I'm sorry, was, remind me?
Well, I just wanted to know if there was anyone that was denied coverage.
Oh,
and
yes.
with
Yes.
pre-existing.
Okay.
That's
yes.
the main.
Okay. So now when it comes to pre-existing, let's just use an example of cancer. Okay, let's say someone has cancer. So for the first 13 months that they're a co-op member, they will have no health plan benefits as on their cancer. Okay, but what will happen is starting month 13 to month 24, this is again on our website, they get $25,000. And when you're talking about natural medicine, that goes a long ways. Okay, so let's just say that the premium is, or the, excuse me, not the premium, the monthly contribution that they pay is, let's say it's $400 a month. So that's about $5,000. They pay $5,000 into the co-op, but they're going to get $25,000 in benefits. So, and now that is the only part that's pre-existing. So if you broke your leg, it wouldn't be, that would be the $1 million. If you had an appendicitis, that wouldn't be included. If you have anything else, it's just whatever's in your medical file that's been being treated the preceding 24 months is considered pre-existing, and that's put on hold until month 13. And then the next month 25, it goes to 5,000. So, and then at month 37, I believe it is, there is no longer anything considered pre-existing, and then the $1 million applies.
Well, I think that's really good to know, because as you said, if someone even is battling like what you were battling, you spent thousands and thousands of dollars on alternative health care that was totally denied. And yet you really believe that it was those treatments that brought a cure on, because you didn't do any other treatments, did you? You were not offered an alternative. You were not offered chemo. You were not offered radiation because they didn't believe that it would work. So you went all alternative. And I think that people would want to know that they could, at the very least, if they had that kind of a diagnosis, get the coverage they need for alternative care. Am I reflecting that correctly? Oh, Carrie, it looks like she froze on us right at the end of this presentation. Are you there, Carrie? No, we've lost Carrie. Oh my goodness. Well, I guess I'll wrap this up because we are at the end, exactly at the end of our hour of the presentation. Know that we're doing one more live presentation tomorrow. So if you would like to get onto that, or if you know somebody else who would like to see the live presentation, bring in questions. We're open to questions. You can always post them even after in the replay down below, and we'll get those questions to Carrie, and she'll make sure that you get the answers that you want. Or I'm sure she'd be happy to talk to you individually if you really have an extensive number of questions. So I want to thank you so much for being here today. Go check out the greensurance.org website. And if you can, tell other people about our presentation tomorrow. It'll be tomorrow at 2 p.m. Pacific time. And if you want to get more information on that, you can email Carrie Gray at kg@greensurance.org. Okay, thanks everyone, and have a great day. Bye-bye now.